These days we have to use our hands a lot, so it's very common to get some sort of pain or discomfort in our hand. But sometimes this pain becomes unbearable, and you need some treatment. That's why in this video we are going to talk about the most common causes of hand pain, how to treat it at home, when to see a doctor, what kind of tests are done, and what are the treatment options. Hand pain can occur due to different reasons. It could be arthritis, carpal tunnel syndrome, bone or joint injury or fracture, nerve compression, muscle or ligament strain, high blood sugar or high uric acid. Today, we will cover everything except the congenital or birth-related anomalies. So let's start. First, we will discuss the general treatment and care. Number 1. Rest. Avoid overuse of your hand, especially if pain is severe. No. 2. Cold or warm compress. For fresh injury or swelling, use a cold pack for 20 minutes at a time, 3 times a day. For stiffness or chronic pain, warm compress would be better. You can use a warm towel or a hot water bag for 20 minutes at a time, 3 times a day. No. 3. Medicines. For mild pain, you can take Paracetamol or Ibuprofen. Those tablets 3 times a day for 7 to 10 days. If you have arthritis or uric acid related pain, your doctor may prescribe specific medicines for a longer duration. Number 4. Physiotherapy or exercises. Gentle hand exercises help reduce stiffness and improve mobility. Some examples are thumb opposition, where you extend your finger straight and move your thumb across each finger. Then finger flexion. Make a fist with your hand and hold for 5 seconds. Release and repeat 10 times. Then wrist flexion and extension. Move your wrist forward and backward 10 times. You can also check out some simple hand exercises and stretches online and practice them every day. No. 5. Splint or brace. Splint or brace can be useful in case of carpal tunnel syndrome or weak joints. You should wear it all day long, or as advised by your doctor. Number 6. Healthy diet. Include calcium and vitamin D-rich foods in your diet, like milk, yogurt, fish and eggs. If uric acid is high, you should avoid red meat, liver, pulses, fried and salty food. You can check out my detailed video on foods to eat and avoid when you have high uric acid levels. The link is provided below. Now let's discuss when to see a doctor immediately. If you notice any of these signs, then immediately consult a doctor. Severe swelling, redness, or pus in hand or fingers. Hand or fingers cannot move at all. Frequent numbness or tingling, especially at night. Any suspected fracture or severe injury. Sometimes you may not notice symptoms right away, but they may develop over time. So if you have pain or discomfort in your hand that does not improve even after trying home remedies and RICE protocol, which means rest, ice, compression, and elevation, then you must see a doctor. To diagnose the problem, doctors use physical examination, 10-ray, MRI, ultrasound, nerve conduction studies, and 24-hour heart rate monitoring. Depending on the type of pain and its cause, doctors offer various treatment options. In some cases, surgery might be necessary. Let's discuss the most common causes of hand pain. Number 1. Arthritis. Osteoarthritis is the most common type of arthritis. It occurs due to wear and tear of the cartilage of joints over a period of time. It mostly affects the older population and people who have physically demanding jobs. Symptoms include joint pain, tenderness, swelling, stiffness, and decreased range of motion. Treatment includes medicines, physiotherapy, steroid injections, pain-relieving patches, and in some cases joint replacement surgery. The second, carpal tunnel syndrome. It occurs when the median nerve is compressed as it passes through the carpal tunnel on the palm side of your wrist. This nerve provides sensation to the thumb, index, middle, and part of the ring finger. So if you experience numbness or tingling in these fingers, it could be a sign of carpal tunnel syndrome. The symptoms usually begin in one hand and later may affect the other hand as well. The most common symptom is pain, numbness, or tingling in fingers. Other symptoms include muscle weakness and atrophy of thenar muscles on the palm side of the hand. Carpal tunnel syndrome can be diagnosed by a doctor through physical examination and nerve conduction studies. Treatment options include wearing a splint or brace at night anti-inflammatory medicines, and corticosteroid injections. In rare cases, surgical decompression of the nerve may be required. Third, trigger finger. Trigger finger is another condition that affects the tendons in your fingers. A tendon is a strong, fibrous cord that connects muscle to bone. When you bend your finger, the tendons in your finger move through a sheath or tunnel. Trigger finger happens when the tendon swells and gets stuck in the sheath or tunnel. As a result, it becomes difficult to straighten your finger. Trigger finger can affect any finger, but it most often affects the ring finger. Sometimes you may hear a popping sound when you try to move your finger. This popping sound is due to the sudden release of the stuck tendon. Treatment options include wearing a splint or brace, anti-inflammatory medicines, and corticosteroid injections. If these treatments don't work, then surgery may be needed. Fourth, de Quervain's tenosynovitis. Do you know there is another condition that affects the tendons on the backside of the wrist? It is called de Quervain's tenosynovitis. In this condition, the tendons on the backside of the wrist become swollen and inflamed. These tendons are responsible for moving your thumb and making a fist. So when you develop de Quervain's tenosynovitis, it becomes painful to move your thumb or make a fist. Treatment options include wearing a splint or brace, anti-inflammatory medicines, and corticosteroid injections. Surgery is rarely needed. Fifth, fracture. Fractures are broken bones. They are one of the common injuries to the hand. Most fractures require immobilization in a cast or splint for 6 to 8 weeks. In some cases, surgery may be necessary to realign the broken bones and fix them with screws, plates, or pins. Sixth, nerve injury. You have many important nerves in your hand. The median nerve, ulnar and radial nerve, on the palm side of your wrist. These nerves send signals from your brain to your hand. They allow you to feel different sensations, such as pain, temperature, touch, and pressure. If any of these nerves are injured, you may experience numbness, tingling, or weakness in your hand or fingers. Treatment depends on the severity of the injury and may include physical therapy, nerve blocks, medications, or in some cases, surgery. Seventh, muscle strain. Muscles are the tissues that allow you to move your body. When a muscle is pulled or stretched too far, it can tear or strain. A muscle strain in your hand can cause pain, swelling, and weakness. Treatment options include rest, ice packs, compression, elevation, anti-inflammatory medicines, physical therapy, and in rare cases, surgery. Eighth, high blood sugar. High blood sugar damages the nerves and blood vessels, so it can cause different nerve-related problems like neuropathic pain, numbness or tingling, burning pain, shooting pain, throbbing pain, lightning bolt pain. You may also have poor healing. High blood sugar also increases the risk of infection. So if you have diabetes and have an open wound or a cut on your skin, you are at a higher risk of developing a serious infection. To prevent this, keep your blood sugar under control. Wash your hands thoroughly, use sunscreen, and don't share personal care items like razors or nail clippers. Ninth, high uric acid. High uric acid can also damage the joints. It is common in people who consume alcohol in excess or eat a diet high in pure, which are found in organ meats, game meats, seafood, and some vegetables. Gout is the most common type of arthritis caused by high uric acid. Symptoms include severe pain, redness, and swelling in the affected joint. Treatment options include medicines to lower uric acid levels and colchicine to relieve pain. We have made a detailed video on gout. You can check it out. Also, we have made a video on top 12 foods to avoid when you have high uric acid. Check it out as well. The links are provided below. 10. Ganglion cyst. Ganglion cysts are non-cancerous fluid-filled sacs that can form on or near tendons or joints. They can occur anywhere in the body, but are common on the wrist. Ganglion cysts are usually harmless, but they can cause pain or discomfort. Treatment options include aspiration or surgical removal. So these were the most common causes of hand pain. If you want me to also share some simple hand exercises and home remedies you can do daily, let me know in the comment section below. I hope this video was helpful. Please like and share, and don't forget to subscribe. Stay healthy. Stay healthy,